Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. I'm very excited to have a guest on today, Mr. Michael Goldberg. I'm just going to give you an opportunity to tell us a little bit about yourself.
Great. Thank you so much for the invitation. Thank you for allowing me to be here today to speak to all of the future physicians out there and maybe people who are interested in becoming a doctor who are not yet in medical school. So it's always great to talk to new people. My name is Michael Goldberg. I'm the executive director of Northwell Health's Long Island Jewish Medical Center. We're located in New York, and our health system spans 23 hospitals across the New York area. It's mostly the New York City and Long Island areas with some hospitals in Westchester. LIJ, where I work today, is right on the border of New York City and Long Island and Nassau County, but we are physically located in Queens. And we're a 600-bed academic teaching facility. And we share the campus with New York's number one children's hospital, Collins Children's Medical Center, as well as a behavioral health facility. And in addition to that, I'm an adjunct professor at Hofstra University, where I teach graduate studies. And the reason I do all of these things, in addition to being able to help care for people in the community, is for my family, who are incredibly supportive of all of the things that take up my time, that aren't revolving around them. But when I get to spend time with them, we love to travel and make great memories together. So it's a pleasure to be here with you today, and I look forward to our conversation.
That's so awesome. And it sounds like we'll have a lot of fun things to chat about. My first question is, what inspired you to become an executive director? There are so many ways to impact healthcare, and you've mentioned a lot of them, and you love being involved in supporting the community. What inspired you to become an executive director? Well,
first of all, I never intended to be in healthcare when I was growing up. I had a family business where I was intending to be a fourth generation business owner, take it over from my father, who got it from his father, and so on. And due to a series of events when I was in college, the business wasn't going to be there after I was graduating, and I was a very strong business major. And so I started looking for different opportunities at that stage of my life to figure out where to spend my career, where to spend my life. And what was important to me was to find an organization and an industry that aligned with my values. And while they were still developing, as you can imagine, when you're in college and around that age, you're still figuring who you are out. And so I had a couple of opportunities at the same time. One was to study finance and start to enroll in an MBA program. And then I searched out internships, and one of those internships was on Wall Street, and I worked there for a few days, and I found that it didn't seem to fit my values the way that healthcare has. But at the same time, I was being offered an opportunity to get an internship in the healthcare organization, Northwell Health. And immediately, when I met the people in the healthcare environment, and maybe surprisingly to some of your listeners, in the finance office, 7 miles away from the closest hospital, I found such a passion from the people that I met for helping another person. And while we were in a back office dealing with finance numbers, I was surrounded by a group of people who became tremendous educators for me about an industry where you get to help somebody. And it didn't matter if you were a clinician or not, you were making a difference in somebody's life. And in that role, I had the opportunity to learn from and get taught by the greatest healthcare leaders that I believe exist in our country.
That's awesome. It's always a point of kind of finding your people and finding your why. And it seems like you have a heart of service, and you were able to find that with your niche and figure out how to contribute. And that's just amazing to me.
Yeah. And what was interesting was when I was in those roles in a finance office, I knew I wanted to be closer to the patients. And so I spoke to mentors that existed in the organization, and I asked them if there was ever an opportunity to get from the back office to closer to the patient care locations, could I be considered? And an opportunity came up for me to work in Long Island Jewish Medical Center. And I came over here as the hospital's chief financial officer at that time. And while I was here, I used it as an opportunity to continue to learn every day from the incredible people that I had the opportunity to be surrounded by. And after a few years of learning and growing and helping others do what they do best, I was given an opportunity to transition from finance into an operational role. And so the path kind of found me more than I sought out the path. And I have been in the role now for about 6 years, a little bit more than 6 years, and I couldn't imagine doing anything different. It's one of the most rewarding things that I think anybody can do, is to have the opportunity to work in healthcare.
That's awesome. And I always tell the students and the listeners out here that it's a journey in life, and everything's not always going to be linear. And you may come in thinking you want to do one thing, like you thought you were going to go into your family business, but life throws some curveballs. So you just go with it, and you'll be very surprised as to where you end up. And hopefully it'll be somewhere where you are thriving and you're kind of living out your purpose.
100%. And the other thing that I'd say to go along with that when you're finding your path is to trust the people around you, because a lot of times you're going to get these little nudges of guidance from people who see something in you that will help you find that path where you have that sweet spot of getting the most amount of value for your personal reward in what you do, while aligning that with a company and a position that best aligns with your goals.
Absolutely. You're only as strong as the team behind you. And I love to talk about having and developing a personal board of directors. So you don't go to everyone for this everything. You have a person that you go to for work, a person about personal things, a person about career progression, and all of these different things. And they come together and they get to learn you and know your strengths and weaknesses best, and help kind of guide you in the right direction, and even see some things you may not have even noticed about yourself.
Yeah, I love that. Personal board of directors.
Yes. So I have a question just about your everyday life. What is the toughest part about being a hospital administrator?
That's an interesting question, because there's so many different facets to the role. And in this job, you're responsible for the safety of everybody who comes into the campus, whether it's a patient, an employee, a visitor. You're responsible for the quality of care. You're responsible for financial performance, operating performance, efficiency, experience for your employees or your customers or your patients. And so one of the tough things is balancing all of that, all the competing priorities at the same time. Another thing, which I learned very quickly when I transitioned to this role more than any other role, is that most people are going to come to you with the things that they need or the problems they have. Very few people approach you with the good news, if you want to call it that, and what's working well, and telling you compliments for other people, although we get plenty of them in many letters, which we're very thankful for. So it's a job that requires a tremendous amount of problem solving and critical thinking in order to address and handle very difficult situations that come up, a lot of times unpredictably.
Absolutely. I'm sure one thing that we could never predict was the pandemic. So what was it like to lead the hospital during the pandemic that's still ongoing in New York, one of the epicenters?
Yeah, so as I mentioned at the beginning, we're in Queens, and Queens is the home of JFK, which is the international airport in New York, and it was the entry point for COVID mostly into our country. And so Queens saw the most significant rise in cases the quickest and the earliest in the first wave. And so the most significant challenge that I'd say was dealing with uncertainty. The information that we had about how to treat the virus, what the virus was, how the virus spread, was very scarce. And when you think about some of the conflicting information, it's, and if you can go back to that, the CDC and the WHO weren't even in agreement with what kind of protective equipment we needed to have in our facilities, right? What kind of mask would be appropriate? When you turned on the news, you saw the people in China and Italy at the time, and they were in full hazmat suits. And at that same time, when we were here, you didn't know if you should have an N95 mask, if you should have a regular mask. Why weren't we wearing full hazmat suits for everybody that was coming into our facility? And I think that one of the things that came out of that was our ability in that time to rise up and trust one another and know that what we were going to do, we were going to do together. And so in those very early days, especially from my role perspective, when cases first started presenting and there was tremendous uncertainty, first it was, I think, comforting to our team members to see our leadership team of Long Island Jewish Medical Center in the hospital, rounding on the units where the COVID patients were, wearing the exact same PPE that our team was utilizing in order to care for them. And thankfully, we found very early on that PPE worked. And as a matter of fact, our first COVID admission at LIJ was on March 4th. Wow. By March 7th, we mandated that all team members in the emergency department wear a mask. And by March 13th, it's actually the same day as the shutdown here in New York, all team members in our hospitals had to wear a mask. And if you could also think back to that time, there was a tremendous amount of press around people not having enough PPE around the country where COVID was. But we made the, I believe, brave decision to make sure that every one of our team members was protected with the best information that we had available to us. And what we saw was that our team members did not get sick during that time frame. And so we were, during an uncertain time, living together, showing up during a pandemic, which I have to tell you inspired me phenomenally for the way that our team members put their own health potentially at risk, but the health of their family members at risk, and came to the hospital because they knew that they had to provide that care for the patients in our community. And at our peak, I'll just give you, I mentioned before that our hospital is a 600-bed hospital. At the peak, we had over 908 patients that we were caring for at one time in our hospital. And that's how much we had to surge in order to accommodate all of the needs of the patients.
That's amazing. And you guys kind of led the way for the rest of the nation as to what was to come and how to prepare for all of that.
Yeah. And, we're happy for what we were able to learn back before the second wave came. But I'll tell you what was truly inspiring was the way that the team came together, how innovative they were, the creative ways that we found to care for people, the amount that we supported one another at a difficult time. It was truly an inspiring time to be in healthcare. And I think the support with the community was something that also can't be overlooked. You had people holding signs outside of the hospitals. You had them sending food constantly. We had tremendous numbers of people supporting us in all different ways. And I couldn't be more proud of the team that came here and was available to our community when we took care of thousands of people in a very short amount of time.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of pre-meds who apply to a medical school don't even get accepted. And if you want to get accepted into a top medical school, it's even harder. That's why more students than ever are turning to MCAT tutoring by Med School Coach. Our tutors are all 99th percentile scorers, have been through rigorous training, and can help raise your MCAT score by 12 points or more. You need every competitive advantage you can get to get into med school, so why not get one-on-one tutoring from Med School Coach? Our expert team will create a custom program just for you and help you master MCAT content where you need the help most. You'll raise your MCAT score. We guarantee it. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach MCAT tutoring package. You can achieve your medical school dreams, and Med School Coach can help.
Absolutely. I definitely agree that there was magic in people stepping up and coming to serve. Which brings me to my next question of, if you had a magic wand, what's something that you would change about healthcare?
Transitioning off the last question, it might be surprising that I don't say anything related to COVID. What I think about when I look at the people that need healthcare in the United States, I think about the amount of preventative medicine that we could do, that we could focus on, much more in this country than we do. And so if I had a magic wand, I would take away 90% of the unhealthy things that we all do every day, right? I would have us all have fresh fruits and vegetables available to us at affordable prices, and the ability to to eat healthy, because we know that that's where a lot of illness starts from. And we know that a lot of people who are unhealthy struggle more to recover when we're taking care of them when they're ill. And so to me, I would focus us much more on wellness activities. I think most of our built environments should be much more supportive of living healthier. How safe is it to walk to the store in each neighborhood and get your groceries and walk home and bicycle and spend more time outside and doing active living, different aspects. And so to me, I would focus, if I had a magic wand, on all the things that create illness and eliminate them from what we're doing each day.
I love every piece of what you just said. I guess we probably have the same magic wand, because for the listeners out there, I didn't tell them what to say and all of that, but I'm a family physician and I do lifestyle medicine. So you're speaking my language, and I definitely agree that prevention is key and living a healthy lifestyle is key, and it can help impact the rest of the entire community and help people thrive and live longer and healthier lives with less comorbidities.
And heal better when they're sick.
Absolutely. Yes, reverse disease, heal better, just live the life that we were intended to live. So hopefully more healthcare systems can incorporate some preventative medicine and lifestyle medicine as things change and expand. Now, getting back to business, you're a businessman. Do you think that it's important for future physicians to learn about the business of medicine? There's a lot of discussion going on out there for people. A lot of practices have gone from private practice to hospital-owned, and now people are doing direct primary care. There are people starting their own entrepreneur investments and moving to startups, and the world is out there, and there's a lot of discussion as to whether physicians may need to seek other degrees like MBAs and things. What is your thought on someone who already has a terminal degree of an MD or a DO learning more about the business of medicine?
I think it's a phenomenal idea. I think that the more each one of us understands our related fields, the better we all become. And so one of the things that I've done is participate in a guest lecture series from Dartmouth College on exactly this, right? How to create a business plan. I've experienced in the 12 years that I've specifically been in the hospital here, I've experienced so many physicians who have phenomenal ideas about how to improve patient care, how to expand services, how to bring new technologies and new therapies into the hospital, but they don't know how to put the business plan together with how to articulate, other than the fact that a person's going to improve in their life, right? What does the business side of that equation look like, right? How much more revenue might there be for the institution? What is it going to cost? What is the intended return that there's going to be? And it doesn't have to be financial, right? Especially in healthcare, one of the great things about healthcare is we have a mission, and that mission is to improve the quality of life in the people that we serve, which means we may spend money on things that may lose us money, but it's the right thing to do for our community. But you still have to put the plan together in order to be able to demonstrate and articulate and set goals for what you want to achieve. And so for me, I think that people studying medicine are, number one, if you're in a healthcare organization, find your finance people, and they could be your teachers. You don't necessarily have to go get an MBA in order to learn how to do this. You can find the people in the organization who do this every day, and they'll spend the time, and they'll be happy to teach you how to put the business case together. At least here they will. And so I think if you could find them, you can get that education by working with them. And it's a symbiotic relationship, right? So I learned a tremendous amount partnering with physicians over the years. I learned it about medicine, right? And you hear about new technologies and new therapies, and if you're interested, you do the research on what they all mean. And so that's what I meant before when I said we all get better by learning from one another. So in the business of medicine, you alluded to entrepreneurship opportunities. And if you're going to be an entrepreneur, you absolutely should have a business degree and an understanding holistically of all the different aspects of what running a business requires, right? From marketing to operations, to finance. And so it's more than just the business plan, but it's applicable in your lives too, right? How do you run your household? How do you manage your checking account? What was the ROI for going to medical school, and how quickly will you pay that back, right? These are all concepts that can benefit anybody in their life by having a little bit of business knowledge.
At Med School Coach, we know that matching into the specialty of your choice and the residency program of your dreams has a dramatic impact on your career as a physician. And your USMLE score is the most important acceptance factor of all. That's why more students than ever are turning to Med School Coach for USMLE tutoring. Our tutors are all 260 plus scorers and have been through rigorous training. Plus, the average student who uses Med School Coach tutoring raises their score by 23 to 55 points. There is an enormous amount of material you need to know for Step 1 and Step 2, and Med School Coach can help you be smart about how to study. We'll create a custom program just for you. Then, we'll help you master USMLE concepts where you need help most. You'll raise your USMLE score. We guarantee it. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach USMLE tutoring package. You can achieve your medical school dreams, and Med School Coach can help.
Absolutely. I couldn't agree more. I think that the more knowledge that you have, the better. And even if you don't necessarily utilize it every day at work, if you have people doing billing and things like that, you can use it at home and in other avenues as you grow. I really appreciate you coming on the show, and we've actually come to our final question, and you've shared so many pearls of wisdom with us. I want to ask you, what is one piece of advice or pearl of wisdom that you would like to leave for our listeners who are pre-med and med students at the beginning of their career journeys?
A great question. So for everybody who's pre-med and at the beginning of your medical school journeys and medical professional journeys, I walk around the hospital every day and I see the incredible difference that the clinicians get to make. And I can only imagine about the decision point that you all had for why you chose to go into medicine. And I hope that it was to help another human being. I don't have that ability, not the way you do. But what I see and what I've been humbled by for the amount of time I've been in healthcare is that is just an incredible gift, to help another human being, to help them when they're scared, to help them when they're sick, to help them when their family needs to understand what's going on and to educate them. And so I guess my request from you is that you never lose sight of why you chose to go into medicine, and that you never lose sight of the gift that you have to make a difference in somebody's life. Because when you walk into that room, you may not always see their faces light up, but they will. And they're lighting up with the trust that they have for you and what you know and how you're going to help them. And I hope you'll never forget that.
I love that. Thank you. I agree. You have to find your why, your mission, and your purpose. And for every decision that you make moving forward, you have to see if that aligns with your why. So that's such an amazing gift. I really appreciate you coming on the show today. I'll give you an opportunity to tell everyone goodbye or how they can reach out to you.
Yeah, thanks so much. I also like to thank Dan at Future MD Life for connecting us. I'm available on Instagram if you'd like to find me at Michael H. Goldberg. I'm on Twitter at M_H_Goldberg. And I'm always available. You can Google me at Northwell Health, and I'd be more than happy to connect with anybody who I can help along your journey when you become a physician.
Thank you so much. And for all of the listeners out there, don't forget to click that subscribe button, and I'll see you again next week.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.